Ethical Perspectives on the News is produced by the Interreligious Council of Linn County, which is solely responsible for its content. The views and opinions expressed on this program do not necessarily reflect those of the staff and management of KCRG TV9.
Good morning. I'm Bob Sessions, Professor of Philosophy, retired. Welcome to Ethical Perspectives on the News. Recently, two Princeton economists discovered a surprising change in the death rates of one demographic group, white people between 45 and 54 with only high school educations. In America, and certainly in developed countries around the world, at worst, the death rates for some groups did not improve between 1999 and 2014, but this one group suffered increased rates of suicide and drug and alcohol deaths. Most of us would expect such results for underprivileged minorities, but those two groups either stayed the same or improved. So what is happening to working class poor whites in America? What can be done to reverse this startling trend, and what are the political and ethical implications of this sad change in the lives of poor, middle-aged, poorly educated whites? With us today to discuss this complex and interesting and very troubling topic, we have three people. First to my left is Pramod Dwivedi, who is the Linn County Director of Public Health. Next to him is Erin David, Associate Professor of Sociology from Cornell, and David Jepsen, retired Professor of Education from the University of Iowa.
Thank you for having me.
Thank you all for joining us this morning.
Thank you. Good morning.
So we don't have a lot of time. It's only a half hour, but I do want to be sure that we're fairly clear on exactly what's being claimed by these two professors and what some of the concerns are with their data and so on. But I don't want to spend our whole time talking about those details. But Erin, why don't you give us your perspective on exactly what it is that they're telling us? You're the sociologist.
So they're mostly looking at changes in mortality rate, morbidity and mortality, but I think a lot of it's focused on mortality. And if you look at this particular group, those who have high school or less than high school education, middle-aged white Americans, they found that there's a sort of increase in mortality rate, which is unexpected and is quite different from other countries, and somewhat different from other racial groups, other age, racial, class groups in the United States. There have been some criticisms that maybe that it's not quite as much of an increase as the economists claim. However, even people who critique it on that level note that there is a difference between what's happening here and in other countries. So I think the question is partly why. What is behind this?
Yeah, just to be sure that overall death rate or mortality rate is declining in the United States, in Iowa, and also in our county, Linn County. What's troubling is really the specific age group among white in the United States, and that since 1999, that has been the death rate and also morbidity has been increasing in that population, although the increase is not a lot. I mean, it's 0.5% per year. But if you look at all these years since 99 through 2013, it's nearly 500,000 people, those who their lives could have been saved. So it's a really, really huge public health issue, social, political, policy-related issues. One thing that they are also talking about in the report, in this article, is that why is this happening? What's causing this? And I think that the main thing that we need to focus is on, looking, probably going forward in the future, we need to look at some factors in this specific group. Because we have been also looking at our data in Linn County and Iowa too, and we have seen suicide rate going up. There is poisoning related deaths as well. Opioids are increasing in our population too. So there are a number of mental health issues, those types of things that need to be looked at carefully.
Mm-hmm. David, what is your perspective?
I agree with the panelists in getting the big picture, and I really appreciate how well they did it. I think the interesting thing to me is how the mortality data were related to the morbidity data. They were very careful to say there were parallels between the two, and they avoided causal language. So we don't know, and in fact, most of the critics and the authors themselves really backed off of saying this causes this, because there's too much, well, the data points are too far apart yet. And so I think they have enlightened us a great deal. The little story I heard about how this came about, how it was published, is that the two authors, or man and wife, the man had just come from Stockholm where he won the Nobel Prize in economics, and the wife has suffered from lower back pain incurable, it says, for many years. So she was very interested in suffering and what were some of the causes and cures of that. And he had large data sets, had this wonderful reputation as well, and they just sort of by accident sliced the data to get this segment that we're going to be talking about, and found this rapid increase in mortality. So it's sort of an interesting story about how science is not all pre-planned.
Right. Well, the comparison to other groups, I think, is really interesting, okay? Because, I mean, clearly, this demographic, okay, are people who are having a hard time making it, okay? They're depressed because they have a hard time finding work or meaningful work or work that's adequate to meet their needs and so on. They get caught in the cycle of taking drugs or drinking and probably get caught up in violence, and their education isn't adequate for finding things better, and they're depending more and more on welfare programs of various kinds and so on. I mean, happily, we have safety nets to help people like this. Why is it that this group, though, whites in this age group, have a different profile than people who are in minorities, blacks and Hispanics and so on? Because that's one of the things the data did seem to point to. Okay, so what's going on? What's the difference, do you think? I mean, it's a way of kind of beginning to tease out what's going on with these people.
Well, I think we first have to say, and I think unfortunately this has not been acknowledged nearly enough in the reports that have been written about this study, is that the mortality rates for African Americans are still much higher than whites in general. Right. So I think why there's such a focus on this is the sort of increase that's happening here. If we just look across the board, I think the reasons why the mortality rate is high for this sort of lower educated group is very similar to the reasons why it's high for other groups. And I know we can't necessarily make causal arguments, but I think there's a social context we need to sort of explore, and you started talking about some of it. The fact that in many cases, individuals in this group are underemployed, or their employment prospects have been declining or been limited over the years. The fact that a lot of these individuals talk about being in chronic pain, and so we do have the rise in prescription drugs and non-prescription drug usage, which leads to sort of the alcohol and drug-related deaths. We also have issues. This is a group that's starting to think about retirement and may not have the retirement savings or the retirement plans. And I think one of the things, you ask how are they similar and how are they different? I think in many ways those are very similar situations for either low income or individuals who have not had college educations. I think college educations are increasingly becoming important for job opportunity in the United States, and that's sort of a shift. And so I think whites in particular, this group, this particular age and education level group, is looking at the future and is not seeing the same opportunities that they thought they would have. And I think with race, if you look at sort of African Americans, there hasn't been the same sense that of opportunity that there have been for white Americans. And so I think this is a group who expected more opportunity and is now facing a situation where they think that they may be the first group that is not doing better than their parents, that they don't see hope in the future in the way that they had anticipated.
And that's a very interesting point that, compared to African American, you are saying that, this age group, 45 to 54 age group, did not see themselves going, becoming worse off than their parents. I think that's a very interesting observation. I think, the other thing is also lack of social support. That could be attributed to, because the way the society is also changing, and that creates problem among this age group. Then the other thing is that long-lasting hardship, job loss. I mean, a lot of anxiety and fear creates these types of problems, where people have poor mental health, poor overall general health is also poor, because they looked at BRFS data, which clearly indicated that this age group people did not see their mental health and overall general health up to the mark. So those are some of the issues that we have to be aware of. The other thing is also, this population is also going into Medicare eventually. That's health care, health insurance is another area which we need to look at as well for this group, especially when they are not employed, if there is a job loss. So they are not ready to be part of Medicare yet, and there is a gap then. So there are a lot of stressors, external forces that are crippling this population, which before was not pressured, which was not crippled the way they are at the moment.
So I think we sort of have two things that we have time to talk about. One is what kinds of things might be done, or might society begin to look at, given that this is a very large-scale, increasing public health issue. And then secondly, how is this playing out in our current political climate? Because let's face it, there's an election and it's being played to a great deal. So let's do the first. What sorts of things might society begin to look at? Because I think Pramod is right that there are a lot of support networks and support features that are just not there for a lot of people.
One of the characterizations of the population that we're talking about is that they have lost contact with some of the supports that other people normatively would have, such as religion, family, unions, and other kinds of fraternal organizations. Neighborhoods. So that adds to the stressors, I would think, or at least it would take away opportunities to reduce the stressors somehow.
And those things that you mentioned, none of them are governmental programs.
Right.
Those are all things that society needs to do to reform communities, help people form communities.
And that's why it's very, very important, critical to look at social determinants of health, and that's what Linn County Public Health, the department, is really focusing on at the moment. Not for this population group, but for the overall, welfare and well-being of our society. I think we need to look at, social cohesiveness, social support system, poverty, connectedness, because we are getting, more and more isolated from the sources where we could get support from. The three areas that article talks about, suicide, opioids use, poisoning, alcohol use, and then the cirrhosis, right? Those,
Liver diseases.
Right.
Yeah, liver diseases. Because they increased. Everything is fine, but those increase, they are accounting for the increase in overall death rate among this population. So at least, we can, as a society, I think we should be talking about, how to at least arrest the overuse of prescription medication like opioids. As I was saying before, that it's really the biggest man-made epidemic in modern medical history, really. So we have to devise a plan by which we can change some of the practices, how we prescribe these medicines to the folks. That needs to happen. And then, there are a lot of other things that we can bring in at policy level, but that we cannot do, at least politicians, political elected officials, they are able to do some of the others, support system or welfare system.
You started by sort of saying what is different about this group, and I think in addition to sort of addressing issues of informal social support, I think if we look at some of the comparisons, they also speak to potentially some things to look at. And you mentioned prescription and non-prescription drug use, which are connected, right? Oftentimes it starts with prescription drug use and then moves to non-prescription. If there have been studies, so we talked about, well, how is this group different from African Americans? There have been studies that show that physicians are more likely to prescribe painkillers to white Americans, and that's partly based on discrimination, but yet it has this different outcome. So I think we need to look at sort of our prescription policies and patterns. The other thing is we can compare, it's not so much that other groups haven't faced economic challenges, but I think it's this intersection of drugs with these economic challenges that are particularly problematic here. And so I think monitoring healthcare is one issue. We can also compare it to other countries, right? So these increased rates of mortality have not been seen in other countries. And I think that largely, or maybe not largely, but to some extent has to do with the gap you were talking about, the social services, the governmental services, that sort of, there are more provisions in many other countries, pensions, other things that sort of create a stronger safety net. So I think we have a couple of issues in addition to social support, which are also very important.
There's another dimension of this, and that's work. Okay, we've talked several times about how people don't have meaningful or adequate jobs. And there are a lot of reasons why that's happening. It's very complex. But one of the factors, I taught courses on work for 25 years when I taught, and wrote a couple books on it and so on. One of the things that I don't hear people talking about nearly enough is that maybe the old jobs are not coming back. I mean, not only in America are manufacturing jobs disappearing, but they are in China too. I mean, because more and more jobs are being done by machines. And it's not just manufacturing, it's in service sector jobs of all sorts. Secretarial jobs and even managerial jobs can be done more and more by machines. It's interesting, historically, when the Industrial Revolution got going, there was a kind of promissory note told to people that, well, if you just do this terrible labor in these factories for a while, it's going to pay off. And it did pay off, okay? And one of the ways that it paid off is you didn't have to have women and children working after a while, okay? You could make enough money because more wealth was produced by less and less work. Well, that's continuing, but the wealth is not being spread around, okay? The only way to get it is through the work and, social programs which don't give you nearly as much. Maybe we need to revisit that issue. Why shouldn't people be making more? And we're doing that to some extent with this push for increasing the minimum wage. At least the wealth that's being generated for McDonald's or whomever should at least in part go back to the workers. But that's a major part of all this. And it isn't just the amount of money, it's the meaning of the work. When work gets reduced to simply a way of making money, then a lot of the social networking, the meaningful relationships and so on disappear because people are being driven so hard.
I was thinking about some of your questions that you addressed to us prior to the program about making it local in some sense. And the parallel I can recall best is the farm crisis of the 80s, which had some of the same, predominantly males were the sufferers. Suicide rates were high. Some of these other things, these other medical problems weren't. So I went back and I thought, well, what did we do? How did how did we help people get through that? And it wasn't so much that I was looking for economic solutions, because those eventually came, and came at a high price, I would add, high price to the farmers. But at the time, there were support groups, there were crisis lines, there were various ways in which those alienated and isolated men could connect with society. I think it's incumbent upon not only political organizations, but churches and retired groups and so forth to reach out to create support groups. I have been in those, and I've seen the effects of those. We know how it works with people with alcoholism and mental illness and so forth. That I think those are some very practical things. The problem is we don't have the professionals. They're all tied up doing therapy probably, but we don't have enough professionals. But I think lay people can do some of that. There are other. I think the press could be a little less difficult on this population at the same time. There's a sense in which they're portrayed as poor and down and out, and they don't really want to think that way, and they don't want the rest of us to think of them that way. And I think it would be nice to say they're trying hard, among other things, or to at least buttress the kind of positive ways of dealing with the stressors.
Well, that's kind of a nice segue into the political issues. Quite a few people, in thinking about this issue, have been looking at the political followers of Donald Trump. Okay, well, it's not a joke. Okay, I mean he's doing very, very well, in part because he's somehow tapping into this very strong stream that we've been talking about, disenchanted white voters. He's very high if you look at the demographic we're talking about. And he's speaking to their frustrations with the lack of work, which is what we were just talking about, and focusing on immigrants who might be taking away their work, doing the jobs that they thought they were going to have, and so on. So he's building on that concern that this group of people have about the people right below them, if you will, on the economic and social ladder.
I think it's also interesting, and this may be connected to that, the way the news has reported on this study. And one of the things I see, you talk about sort of appealing to white voters, is that the headlines almost all just talk about increasing mortality among whites. Occasionally you'll get middle-aged whites. In the headline, I think there may have only been one headline out of many articles. So I think 75 to 90% of headlines are just focusing on whiteness. And I think it's sort of this attempt to sort of draw in viewers in a way that's kind of disingenuous, because this to me is really a class issue in a lot of ways. It's really focusing on some of those economic changes as well as public health challenges. And I think there's a way in which it kind of undermines the ways in which we can really start thinking about how do we address this problem by creating divides. Because the other thing you don't see in these articles is the extent to which this is still, the mortality rates for African Americans are still higher than whites. And I think for many of the same reasons, although there are nuances we've been talking about. So I feel like there's some of this divide strategy in the way even the media buys into this, which I think is really problematic.
Well, I think it
rich. But they're really, in following him, going against their own interest, okay? To be against social net programs that are going to help people that don't have adequate lives because they can't find good work and so on, because they don't have educations. That goes against their own self-interest. If you had such a person in front of you, okay, what would you say to them to try to convince them that maybe we need to increase the social network support that's there rather than decrease it?
I think, the data needs to be carefully analyzed and presented to people like, those who are seeking elected office, and make sure that they understand it and the implications of this on our society, because it's going to be devastating if we don't. I mean, we have made enormous progress, right, in terms of reducing mortality, and we don't want to lose that momentum. And for last 15 years, it seems like we haven't even taken note of this. So it's a really huge, demagoguery and rhetoric won't work. There has to be some transformative leadership, and national leadership has to be accountable. And this is not just, that we have to do this or that. There has to be very practical, evidence-based scientific approach to deal with this problem.
Erin, what do you say quickly?
I would agree. I think we need to, instead of focusing just on sort of individual issues, we need to think about the public health and the structural issues. I think, as much as possible, sort of outlining that evidence and sort of talking about the ways we can all benefit from stronger public health initiatives.
I had a friend for several years who would fall in this demographic that we're talking about. And my first problem was to get him to vote. And I think that's going to be the problem Donald Trump and all the candidates have. This group of men, I don't think will show up at the polls very, very much until somebody takes a personal interest in their welfare.
Let me just say it's also women. In fact, that some of the studies indicate that women are facing a greater risk. So that's another side of it.
Oh, it is.
Well, I'm sorry we have to end this conversation. We obviously could go on a long time. But I want to thank all three of you for coming this morning.
Thank you.
Very interesting and
Thank you
helpful
for the
conversation.
invitation.
Good work.